Thank you, Ms. Vargas. And we'll start again with you on this next question, which is, in the current economic climate, the county hospital is under pressure to serve the needs of the uninsured. How would you address this issue? And we will have 2 minutes again for this question.
First of all, I want to say that I absolutely support the right of everyone to have medical care. It's not a privilege, it's an absolute right. One thing that we've seen with the recent passage of the Healthcare Act federally is an increasing focus on local healthcare facilities rather than the older county hospital model. Over where I live on the coast, we have people who don't have access to transportation who need health care, and we really need to find ways to provide health care in a more of a satellite type of situation where people can get the care they need, referrals to larger hospitals when they need it, but really everything needs to be localized to be more effective. As far as who's served by the county hospital, that's been a topic that has been out in the press recently about who gets service and who doesn't. I believe that working with the hospitals in the area and the hospital consortium in a persuasive way so that they can take over more of the actual charity care, which is services that are given to people who have no expectation of being able to pay, is really important to try to distribute that care in a larger system. Healthcare historically has been a large part of the county's budget. It's something that we're going to continue to have to look at and find other ways of providing health care, number one, that's more effective, and number two, serves more people for the same amount of money that we have to spend. Thank you.
Just to follow up on the question you had before in terms of local or collaboration throughout the Bay Area. When I was the sheriff, we did work with all of the other counties on disaster planning for in the event of a major earthquake. So I have lots of experience working with Alameda County, Contra Costa, San Francisco, as well as Santa Clara County. But the hospital problem in San Mateo County, it's a major cost item for the county. It's about $70 million a year in subsidies. And one of the ways, there's a couple things that I would do. First of all, we have a lot of first-class private hospitals, and they're all non-profits, meaning that they don't pay taxes. And for that privilege of not paying taxes, they are supposed to take a certain amount of charity care. The average charity care taken by hospitals in San Mateo County is 2%. The national average is 6%. So we need to work with those hospitals to actually take on more of that responsibility. The other is a big area that the county has. We have a big skilled nursing facility that we took over the county, they took that over several years back. There are well over 200 people in that. We need to work with the state and federal government to allow us to keep the same amount of money from Medicare, or Medi-Cal that is, and some of those patients in the skilled nursing facility could in fact be put for higher quality of life in other kinds of assisted living facilities. That we need to get that population down to reduce our cost from that Burlingame long-term care. The other thing about the county hospital, there are only about 35 people inpatient. There are empty wards. What I would propose is doing some modifications to those empty wards, make those wards skilled nursing facilities so that we could close that Burlingame facility and move those patients over to the hospital, which is a great facility, and that would, I believe, save about $10 million a year.